Namaste. Let us take few more examples of indisposition. I will show you the case. This case appears to be so much frightening to the patient as well as to the doctor. But if you give time, if you wait and watch, these things go away on their own. Homeopaths start dancing if they happen to get a case of herpes with a few eruptions. These cases, they are self-limiting. They go away on their own. You should not give credit or take credit for such cases. This happens, Homeopathy is considered, if you consider homeopathy as a medical science, and if you study it as a medical science, then you will understand it properly. Why things are coming and going on their own. People who don't have any clinical knowledge, people who have read books, they think that they have done a great job in such cases. There are so many cases I am going to show you which I have cured without any medicine. For example, take this young person of 21 years of age. As you can see, these blistering eruptions, it seems as if he has been scalded. There are watery vesicles in this person's, chest area is involved. This is a type of herpetic eruption. Okay. When the person came to me, he was already suffering from 3 or 4 days. He had gone to the allopathic doctor. As usual, the allopathic doctor had given him tons of medicine. Now, what is the role? Not only homeopathy, allopathy also, it's a viral infection. And we don't have any medicine for viral infections. I'm talking about what? The allopathic people. Then why unnecessary to give medicine in such cases? So much medicine, so much antibiotic. Now, when I ask the patient, is there any problem you are having? This is a problem. This condition is a problem itself. But he was not having any problem. The condition was painless. Since 4 or 5 days, he was having this problem. Since the time it erupted out, there was no fever at all. The complaints were absolutely what? Painless. He was not having any discomfort except the cosmetic problem. Cosmetic problem, it looks so much frightening. It looks so much dangerous. So in such cases, you have to explain to the patient that, don't worry, it will go away. It is not a dangerous disease. The first step I took is what? I told him to stop all the medicines which he is taking because it is of no use. In fact, the medicine will cause some problem. So much medicines, they are being prescribed in such cases. I cured this person. In the next 7 days, all his complaints went off without any medicine. I told the patient, these are opportunistic infection. I tried to find out the cause. What can be the probable cause? Why did this person get this thing? But there was no cause he could give. I generally, if you are near an animal or if your body is very weak, in such circumstances, you get these things. But, there was no cause. The person was healthy. These are the cases which don't have explanation. We cannot explain it scientifically. Why did the person get this thing? He just got, but it is a viral infection. It is self-limiting disease. You just have to wait and watch. And after 7 days, less than 7 days, I told the person, to stop all the medicine, and I asked him, I told him, if you don't take medicine, then also it will go away. But the person, they think that they should do something. The person who is suffering, he doesn't want to, wait and watch. He wants to do something. He might understand or he might doesn't understand. He wants to do something. His friends and relatives, they want to do something. Here the question is not of what getting well. The question arises what? I am not doing anything. The human mind is like that. No, he told me you give medicine. And what I prescribe? Placebo. Just a bottle of water. In this case, when I am explaining, nobody will listen, People want medicine. So, for the psychological impact, I gave him placebo. Okay. I used the LM potencies only. So, I gave him 100 ml of water to take 2 times a day. He didn't come back, so I couldn't. I have a habit, of inquiring what happened to the patients. The problem is that, patients don't come to you when they get well because, they feel they have to pay fees or, there are many things they have to come away. Nobody goes, okay. But I have a habit of inquiring in such cases or every case, whatever I handle. The person feels the doctor is calling him, but I inquired from a friend of him that he was fine after 6 or 7 days. Without any scar and without anything, without any suffering. These are what? Opportunistic infections. But such cases are freaks of nature, you can say. It happens sometimes. So, this is type of what? Indisposition. Now here, in this case, the person will go to take medicine. The person who is giving the medicine, he might be a qualified homeopath or he might not be a qualified homeopath or he might be a quack. I consider allopathic doctors also. If he is a qualified doctor and he is prescribing unnecessary medicine, like very high grade antibiotics in such cases, I consider them also as quack. You have to wait and watch. You don't have to destroy the person's body. The antibiotics and unnecessary things given to the person causes lots of trouble to the person. But they don't understand that after taking so much of antibiotics in a viral infection, they are getting burning in the stomach, burning urination, and the stools have become hard. They don't understand it is because of the medicine. They go for treatment, then they go for treatment of these things to the same doctor, and then the cycle goes on. Okay, so this is a case of indisposition, one case. Take another case. This is a young person, who wanted medicine. Here is another case of a 75 or 80 years old man. Again, you can see that, he is suffering from what? Herpes eruption. Now, this person has come to me after 8 days. He had the eruptions, he had the herpes 8 days ago. He went to the doctor and the doctor had given him injections and what not he has given. Okay, but this person is a community singer, here also, his condition is painful. He cannot open his mouth. He cannot eat. But he is coming to me after 8 days. And he had already taken lots of injection, but lots of antibiotics has been prescribed to him. But you can see the eruptions are drying. When he has come to me, they are on the verge of getting cured. You should know how the things recede. Scabs have already been formed on the eruptions. They have dried. Okay, but he is still having pain, okay, while eating. See, any person who suffers, he wants his problem to be solved immediately, which is never possible with medicine. Immediately, what you can do, the feeling of pain can be, with the help of painkillers, the feeling of the pain, he is having pain. So that feeling can be, what you can say, it can be benumbed. We have an allopathic system of medicine, have such things that you will not feel the pain. The pain is there, but your system has been, you can say, it has been what? Anesthetized with the painkillers. The nerve endings are not allowed to send the impulses. The pain is there, but with the medicine, what you can do, that you can, but the eruptions will not go away. As I told you earlier, the conditions for the skin need 7 to 10 days to get healed. He is having pain, his problem has become very much mild when he came to me. And whatever suffering he had to go through it. It is a viral infection. Lots of injection, lots of things are given to him. But those things didn't, help to dry the eruptions. The eruptions are going on its own. The person is having pain. That pain can be, and it is timely, you give the painkiller, you will not feel the pain, or you will feel less pain for 2, 3, 4 hours maximum, and again the pain returns. But here also, what is there, the eruptions are getting dried, he is having little bit pain, he cannot eat. Initially he couldn't eat at all, now he is eating. So it means, he is on the road to recovery. I am saying recovery because the body is bringing out about the healing. Here also there is no role of medicine. He is 75 years old person. I am showing you this case. I explained to the young man, that it will go away, don't worry, we have to wait and watch. If it increases also, then also we have to wait and watch, and then I will prescribe. But he wanted medicine. To this 75 years old person, I explained to him that, you are on the verge of getting cured, and probably in next 3 or 4 days, you will get this thing, it comes and goes, and it will take 3 or 4 days, and you will be fine. If you don't take medicine, then also it will get well in 3 or 4 days, and after that, if you are having some problem, you come to me, I will help you out. This person agreed. He is 75 years old, not so much qualified, but he could understand. So these are self-limiting diseases. You don't have to give credit to homeopathy. In such cases, you give 4 remedies, you give 5 remedies, you give 10 remedies. Whatever you give, the person will get cured, or the person will recover on his own, and you feel that your homeopathic remedies, or you have done a very great job. This is not homeopathy. Clinically, you should be able to explain things. When you are prescribing a thing, when you are prescribing a remedy, you should show what are the symptoms in the patient. Here in these cases, what I mean to say, recovery happens on its own. So in these cases, whatever remedy you give, the person will get well, and you will start dancing. Homeopathy is such a great science. No, homeopathy doesn't become a great science in such cases. I am going to show you cases also where homeopathy becomes a very great science. But in such self-limiting diseases, you cannot give credit to the doctor, neither can you give credit to homeopathy. Thank you. Namaste.